Hi, so my name is Kayla Bates, and I decided to do a just a short uh, little overview of a short journal that I found by Tracy Hampton, and it's on the effects of stress on children. So that's kind of just going along with the research that I've been doing for my project, and I just kind of wanted to kind of list some of the key points that it goes over and that it talks about. Um, so the effects that chronic stress has on cognitive function, one of them being regulation of emotion. Of course, it's going to affect behavior and then also resistance to distraction. So we label that as ADD or ADHD, and that's pretty often seen with children. And then atrophy of neurons and memory impairment. So, and then the article kind of goes on to just briefly mention that the ability to cope might play a role in the level of distress that is seen by chronic stress. So, I mean, I think that's pretty obvious. If you're able to cope, then it's not going to take as much of a toll on you as it might for somebody who is not able to cope as well. That's that's pretty obvious that might be the case. And then the article kind of mentions that there might be a relationship between a relation to neurobehavioral complications with quality of life. So the more complications you have, the the um, the more your quality of life might be affected. And then it also relates to coping and adaptation. So if you're not coping as well, your quality of life might not be so great. And if you are, if you're coping pretty well, your quality of life will be better. So, and then it also mentioned a study that was done on cancer patients. So children with cancer, that might suggest that that the chemotherapies and the different therapies done on them might affect the myelination in the brain. So myelination, that is basically the process of creating myelin sheath that it's like a protection. It protects the nerves, the neurons in the brain. And then so I mean that makes sense if the myelination is affected, and then we go over here and we see the atrophy of neurons. If that protection is not there, if the myelination, the process of creating that protection, is not there, if that's being affected, then the neurons are not being protected. So we're going to see damage there. Those are going to be affected. And with that damage of those neurons, with the damage of the nerves, we're going to see an effect on cognitive function, because this myelin sheath, this protection that's on the neurons, on the nerves, is allowing for nerves to have a quicker impulse. So if that protection is not there, you are going to see an effect on these nerves, on these neurons. And so with that, they kind of want to just relate this effect on the myelination by the chemotherapies and that kind of stress. They kind of want to relate it and see how it might correlate with just regular chronic stress, chronic like emotional stress, and see how that might affect behavior and cognitive function in children. So I thought that this article, this journal, was pretty interesting, and I think that it's something that I might include in my research. And yeah, I hope that I can find more. But I do appreciate doing this short little video. So thank you.